Hello, my name is Ashley Bowler and I'm a leading health nurse for our community. My main focus is on health promotion and risk reduction for the pediatric population. Based on compelling information and recent funding, I have been asked to deliver a proposal in order to develop, implement, and evaluate a community-based program in order to combat particular health determinants faced by our children. Within this proposal, I will discuss why our pediatric population is vulnerably at risk, a comprehensive assessment performed by our community on this particular population, community-based needs determined by health diagnoses, proposed interventions and consideration to address these diagnoses, how health models apply to our efforts, and an evaluation plan based on these efforts. The population that we will be discussing are children or pediatrics. I can bet that many of you are parents and maybe even grandparents. And if you're not now, I'm sure there are plans in your future to become one. As a parent or grandparent, maybe even an aunt, uncle, cousin, or godparent, I'm sure you want the best for the children in your life, right? Well, just who is considered a child? Under the Family Law Act, Chapter 25, Part 1, a child is legally defined as a person who is under 19 years of age. The CDC also expands that definition to include varying subgroups of the population, which include infants, toddlers, preschoolers, middle childhood, young teens, and teenagers or adolescents. Children aren't always just considered blood related. Children can also be someone that falls within this age group that is solely dependent on another individual for their social, emotional, and educational needs. Based on these dependent needs, many health determinants can affect these children's lives, leaving them at risk and vulnerable. Determinants can include, but are not limited to, individual, which are activity, diet, age, relational or social, socioeconomic status, support, communal, availability of resources, transportation, or environmental influences, housing, living conditions, food, water, etc. Children in our community rank relatively high when it comes to health disparities compared to other neighboring county, state, and national levels. Detailed statistics will be discussed later. A healthy community is a place where people provide leadership in assessing their own resources and needs, where public health and social infrastructure and policies support health, and where essential public health services, including quality health care, are available. In order to ensure our efforts were on the right path to healthy improvements for our children, a community assessment was performed to help identify community needs, clarify problems, and identify strategies and resources. Based on recent information collected from county health rankings, the following 8 factors were associated with children. 19% have poor to fair health, 7.6% are born with low birth weights, 35% are obese, 24% suffer from physical inactivity, 21% are uninsured, 27% live in poverty, 37% live in single-parent homes, and 17% live in homes with severe housing problems. A large part of our community is comprised of Spanish-speaking and minority families. When evaluating these statistics, literacy, cultural competence, and community resources were considered. Based on the previously obtained information from the county health rankings, the following 2 subject areas were considered of great importance: obesity and physical inactivity. The following 2 community health diagnoses were prioritized based on these considerations are in alignment with the Healthy People 2020 topics and objectives. Childhood obesity related to sedentary lifestyle habits, poor nutritional choices, and lack of knowledge about long-term effects. physical inactivity related to a decline in extracurricular activities, funding, and limitation constraints with physical education requirements. Now that we have determined just what our community children need, what are we going to do about it to help them? First, in order to decrease the prevalence of childhood obesity, children should be screened, which is primary prevention, on a continual basis for risk factors associated with obesity. This can be done by the school nurse, primary care physician, or other qualified individual. Screening should include complications of cardiovascular, metabolic, musculoskeletal, respiratory, and renal health, as well as daily activity levels, consumption of high-calorie foods, and knowledge about habitual healthy habits. Education, which is a secondary prevention measure, should be provided on ways to improve or eliminate unhealthy habits, and maintaining, which is tertiary prevention, a healthy weight. Interest in activity-based hobbies, healthier lunch and snack options in schools, and instilling the knowledge into these children to live a healthier, more productive life is our goal. As part of a component in childhood obesity, physical inactivity is a related deterrence. Improving health, fitness, and quality of life through daily physical activity is the Healthy People 2020 objective for physical activity. Again, screening is a vital tool in primary prevention for determining those at risk for physical inactivity. These can be individuals that are not active during PE or recess, or who refuse to participate in school activities. Educating, again secondary prevention, on the importance of physical activity not only in PE but other areas of schoolwork can ensure some sort of activity level is maintained. Finding creative ways to make kids more active can guarantee these healthy habits will be maintained, which is tertiary prevention. We should start small by asking volunteers and parents to teach PE classes at the local schools to incorporate more physical activity back into the curriculum and provide an array of culturally appropriate activities for all minority groups. The activity pyramid is a great place to determine where a child falls within the physical activity spectrum and the next steps to advance to. Dealing with diverse cultures within the community can be challenging. We do not anticipate any ethical issues to arise since we are taking every precaution necessary to ensure these interventions will be appropriate for all. The interventions proposed will comply directly with any ethical regulations. However, if any issues do arise, prompt intervention will be initiated to mitigate and resolve the issues at hand by staff personnel equipped to handle such issues. Based on the culturally appropriate interventions of activity and nutrition, and after an informative community meeting, we anticipate compliance with community readiness will be positive. The parent-teacher organization, the athletic club, and the cafeteria will all have representatives involved with this movement for support and participation in our objectives. The logical model was used in order to anticipate the goals, objectives, activities, and outcomes of our project interventions. The goals include childhood obesity, sedentary lifestyle habits, poor nutritional choices, lack of knowledge about long-term effects, physical inactivity, decline in extracurricular activities, lack of funding, limitation constraints with physical education requirements. Those are directly related to the objectives in which we've established. Primary, secondary, and tertiary preventions, which we have discussed, are all part of the objectives in which we strive for. Activities, which include screening for obesity, educating about health risks associated with obesity, educating about benefits of staying active, maintaining a healthy weight, healthy meal and snack options, engaging activities, and culturally appropriate activities and meal options will all be addressed within this project. The outcomes based on these activities are screening will take place in schools and doctors' offices. Children are able to explain the risk factors associated with obesity. Children are able to explain the benefits of staying active. Children will maintain a healthy weight. Healthy meal and snack options will be provided at school, and children will be able to make those choices at home. Children will also participate in physical and cultural appropriate activities. This is a logic model in which we have discussed external factors, which include ethical issues, community readiness, and supporting organizations, were discussed. Our evaluation plan is key to the success of any program. Monthly, quarterly, and yearly evaluations will be conducted to determine the success of project implementations, the number of active participants, children who complete an individualized program and who show competence in subject areas of physical activity and nutrition will be rewarded accordingly and encouraged to help others meet their personal and project goals. The county health rankings will be compared to the previous years for any improvements and interventions will be adjusted accordingly on an annual basis. Costs will be supplied through community and government-issued grants. Biannual and annual production reports will be compiled and evaluated for accurateness, sustainability, and improvement. I propose to you and ask that you consider a movement that not only betters the lives of current children in our community, but has the everlasting effects on generations to come. We should start small by asking volunteers and parents to teach PE classes at the local schools to incorporate more physical activity back into the curriculum and work with the cafeteria to provide healthier eating options and snacks to ensure a well-balanced diet is maintained throughout the school day. These small and simple changes could eventually progress into a community center that is not only safe for our children, but offers well-equipped facilities with a variety of interesting activities and teaching opportunities. These opportunities will not only teach children how to live and maintain a healthier life and weight now, but will provide them with sufficient education and resources needed to maintain these changes throughout their adult lives. In order to combat inequalities and challenges with such a project, it takes more than just optimism and money. It takes the dignity and diligence of community members, much like ourselves, to advocate for change and be the change that we see. I ask you, as an individual and a community member, whether you have children or not, how are you going to make a difference for the lives of these children? Thank you, and I look forward to working with you.